Healthcare coverage for hundreds of thousands of people in North Carolina is hanging in the balance. This week marks 15 years since the Affordable Care Act opened the door to health insurance for millions of Americans, all income levels. Now, proposed budget cuts by Congress could be the end of coverage for many people in this state. WRL's Sean Gallagher joins us live from downtown. And Sean, how many people are we talking at risk?
Yeah, Gerald, Medicare coverage expanded a couple of years ago, allowing for more than 600,000 people to get health care across the state. But now, with possible funding cuts in the federal budget, all of that progress could be wiped away.
Around her neck,
this is a piece that I made,
is Jennifer Snow White's handmade jewelry, a life's passion, a life she's grateful to still have.
I had a tumor that in January was the size of a pea, and by March it was the size of 2 golf balls.
Life-saving care thanks to the Affordable Care Act.
We made enough money to keep us ineligible for Medicaid, but not enough money to pay for private health insurance.
But the future of affordable care is now in limbo.
Congress is proposing massive cuts that will hurt North Carolina.
NC Medicaid Deputy Secretary Jade Ludlam spoke to the NC Navigator Consortium Monday, a group that guides people like Jennifer through the health care system, services that may no longer be needed.
I am concerned. I think it's a real possibility, but I don't know that it's a probability.
North Carolina lawmakers agreed to expand Medicaid to people making up to 138% of the federal poverty level in 2023, as long as the feds paid 90% of the costs. If it goes below that, coverage for more than 640,000 people could be lost. And Ludlam says there's no safety net.
Local legislators have expressed really no option other than what we have currently. So there is no plan, no backup plan by local legislators to move forward with something other than expansion, as it is.
Because without insurance, stories like Snow White's wouldn't have a fairy tale ending.
I can't imagine, though, saying that same thing if I had been one of the people mentioned at this conference who was uninsured and then dead.
So I have reached out to lawmakers about how this budget could impact Medicaid in the state. And Senator Tom Tillis tells WRAL while looking at ways to improve Medicaid, he believes any proposals should be focused on addressing fraud, waste and abuse, eliminating administrative burdens, and improving the delivery of care. Now, Ludlam tells me that the best thing people can do at this point is reach out to those lawmakers to tell them how important Medicaid has been to their life. In Raleigh, Sean Gallagher, WRAL News.